I'm with AKRC, Anishinaabe of Kabab-Tolgang Resource Council. I'm the Economic Development Advisor at our tribal council. I'm from North Kamiwani First Nation. So I'm going to introduce you to Amy Montgomery. She's the Senior Environmental Health Public Health Officer for the First Nations and Inuit Health Branch, Indigenous Services Canada. Amy has worked with First Nations in Thunder Bay West area since 2006. Prior to working with First Nation communities, Amy was employed with Thunder Bay District Health Unit as a public health inspector, specializing in infectious diseases. Amy attended the University of Cape Breton and was successful in her Bachelor of Technology, Environmental Health. She is also a certified public health inspector of Canada. Amy lives in the rural Thunder Bay with her husband and two daughters on her hobby farm. Oh, cool. So take it away, Amy.
Thank you. Thank you very much, Darlene. So again, my name is Amy Montgomery, and I work with the Environmental Public Health Program of First Nation Inuit Health Branch. And today I am going to talk to everyone about housing and environmental public health. So I'm just going to queue up my presentation. There we go. So again, today I am going to chat about housing and environmental public health and the services that we provide under our program. One of the biggest things that we've had to collaborate with the communities and try and really think outside the box as far as program delivery, and that's really been adapting how we deliver the program to meet the needs of the individual First Nation communities. So our program, I know there may be people attending from other provinces as well. I work in the region of Ontario, but we are a national program that is found all across Canada. The Environmental Public Health Program works to identify and prevent environmental public health risks that could negatively impact the health of a First Nation community. We then provide recommendations for corrective actions that may be utilized to reduce the risk. So the important guiding principles of our programs, clearly the first and most important one is working with communities as active partners when delivering or planning our program. What are the priorities of the community? And of course, understanding every community is different and has different priorities. So that's important for us to work directly with individual First Nations. We do collaborate with all sorts of individual stakeholders such as public health workers. We're seeing a lot of collaboration during times such as this, unprecedented times of a pandemic, working with provincial, public, local health authorities, First Nation organizations, and other federal and provincial departments. And we all work together to try and deliver programming within the communities. We also strive for a level of on-reserve environmental public health services that is comparable to off-reserve. So here in Ontario, we have public health units with health inspectors that deliver inspections and this type of programming to communities, municipalities in Ontario. And our program, we try to provide services, we aim to provide services that are comparable to those that are available off-reserve. So what is the role of an environmental health officer? I hope many of you have had discussions with our environmental health officers and have had some good collaboration and work experiences with them. Again, we do provide advice, guidance, education. We provide health inspections and recommendations to the First Nations. We want to manage any risks associated with the community or the environment. We do gather data and we look at that data to determine what areas we should be promoting in public health. And communities do that as well. Communities may look at their mold data over the years, their information that they've collected on the homes for specific issues, and they would utilize that and work with us and say, these are the priorities, and this is based on the information that we've collected. We do have environmental public health officers that are employed by Indigenous Services Canada, but we also have some organizations that have recently devolved programming, which means that they are First Nation organizations, and the EHO program is run directly out of those. So in Ontario, we have quite a few new devolved organizations, and the EPHOs are working for them, or the EHOs. And I know in every region in Canada as well, it's very different. For example, British Columbia, there is no more First Nation Inuit Health Branch. They have a health authority. So all of their EHOs work under their health authority. In other regions in Canada, a lot of the EHOs are devolved and work for other organizations, and some continue to work. So it's really a mishmash through the country at this point. All of the environmental public health officers must be certified as a public health inspector of Canada. So the core programming that we deal with are 8 core programs. I think the most common and most familiar would be drinking water. So we work with communities to ensure safe drinking water for the communities. We also do a food safety program. So that may include inspections. It may include investigations to foodborne illness. It may include food training. So food safety certification is something that a lot of communities have identified as a priority for anyone preparing food. Today, we're talking a bit about health and housing, wastewater, so large wastewater systems. We work with the communities, or small on-site septic systems or sewage systems. Another area of programming is solid waste disposal. Facilities inspection could really cover any facility within your community that you would like us to come and have a look and sort of do a walkthrough and see if we identify any areas of concern. Or you may be very well aware of areas of concern, and we can just provide you with additional support or an inspection that you can utilize to help remedy that concern. We do communicable disease control, so we investigate all sorts of things. We're working with communities on animal bites, so things to prevent rabies if we have dog bites. We work on programming such as Lyme disease or West Nile, and then of course foodborne or waterborne diseases individually or outbreaks. We would work with the nurses and the communities in that capacity as well to try and A, prevent the spread, and B, find out where that particular pathogen or disease causing microorganism may have come from. And then, of course, the final piece is emergency preparedness and response. And really, all of these programs can fall under that. If we have an emergency at the community level, we have to think about all of these things to ensure that if the community doesn't have access to certain things, then there's definitely could be health concerns. If there's inability to access safe water or sewage systems in the event of an emergency. So they all tie in. It's certainly a very large area of all sorts of exciting projects that we can work with the communities. So this here is just out of our manual directly. I'm not sure if anyone's seen it. It's a little pamphlet, and if you don't have a copy and you would like one, you can certainly pop over to the trade show booth tomorrow and we can make sure we get you any resources that you're interested in. So this just sort of reiterates what I've talked about a bit, and really what is a healthy home? A healthy home is physical and social conditions necessary for the people that live in there. They have to feel safe. They have to be safe. They have to be healthy, have access to things like water and sewage to have access to hygiene, proper hygiene, and of course, comfort. So when we do public health assessments of homes, it's always on request and with permission of the band. We may look at things like indoor air quality, maybe contaminants or pest control, sometimes the water supply, sewage disposal. So we can have a look at a home and provide an inspection. We also can review plans from a public health perspective for any new housing developments. An example there would be if it was all on-site sewage systems, we would work closely with the housing manager and the economic development person, just to be a part of that process all the way along, and again, providing guidance. And then, of course, if we see any workers or things related to stages of housing where we can provide advice, whether it's during a demolition of a home that had mold, how can we do that safely so that your workers are safe and protected, and the people that lived in the home or lived around the home are safe. Public education, we try to provide any public education regarding housing and our program. So if you have an idea, we are open to it, whether it's pest control, mold, radon, just general, certain training on HRVs. I think we had a really great presentation already, or one's coming up on HRVs during this session. So if we can't provide you with that specific training, we certainly will work to see where we can help you access that training. And there's a lot of amazing organizations that work with the communities. And so that's sort of our role in housing. It can be many different things. And of course, in times like this, we're really looking at how we adapt program delivery. Previously to COVID-19, we would attend the communities. We would try to attend on a regular basis. We would work with the chiefs and councils, let them know our schedule, ahead of time, and then we would go in the community and do our work. And obviously now things are very different. So there's a lot of things that we have to think about before we just jump into a car or a plane and head to a community. And I think one of the biggest ones, and we're seeing anyone who's in Ontario right now, is, the requirements and the restrictions are changing all the time. So not only in the province or the country, but also we have to recognize that each of your communities has very specific requirements for access and maybe restrictions in place. So we will continue to work with your chief and council and your representatives to make sure that we are following those requirements and restrictions. The other piece is that we also have been provided by our headquarters offices. There is a safety guidance piece for our staff. So if I'm sending an environmental health officer into your community, how do I protect the community as well as protect the individual coming in? So this guidance has been updated throughout the last year and a few months as situations and best practices change. And I think we are all very familiar with the constant changing of guidelines and recommendations, and it can be very overwhelming, but very important that we have the most up-to-date information when it comes to having people access your community or visit your community. EHOs are responsible to ensure that they support the safety of their coworkers and their community members. So when they come and have a plan or a visit with your community for any housing issue or any issue, we're going to make a plan with the community contact. And so we will discuss with that individual the day that we're coming. Does that work? Are you able to meet us? This is the PPE that we have to wear. Are you going to have access to PPE? We want to make sure that they're comfortable meeting us, that they have access to the required things that they need. And some of our directions may have us in more personal protective equipment than the people in the community are wearing in that scenario. So again, we want to make sure that we've explained all of this before we come in and people are comfortable with the plan. All staff that fall under FNHC do have a directive for self-screening for COVID-19. So this is something that we do every single day. We self-assess to ensure that we're able to meet those screening questions, and that's a requirement at work. Not just for entering businesses and things like that. That's for us when we come to work every day. We have to ensure that we're doing that screening of ourselves. So another thing that has changed, obviously, is communication methods. And if your inbox looks like mine, you probably have a lot of messages. Your storage is filling up really quickly, and I suppose you probably don't have the time to read everything. So it's been very challenging to go through all of the messages that all of us are receiving. I know at the community level, there's regular business still going on. Things are happening that are outside of COVID. So you're bombarded with COVID information, plus you also have important priorities and things that are happening in your community, regardless of COVID. So we are trying to be aware of that. We're trying not to bombard our communities with too much information. We know a lot of the health information flows directly through the nurses and the health directors or community health reps at the community level. So there is something in place where all new guidelines, all new information is accessible. They send it out on email. So we try not to double that. We try not to send you a bunch of things that we know that you maybe have been sent already. With that being said, we want to help as much as we can. If you're in a jam and you're trying to find a guideline, you don't know if one exists, whether it's for a daycare or for a home or for a school, we will help you find it. And again, we may not be able to pull it up right in 1 second either, because we want to make sure that we have the most applicable and recent information, most protective information for whatever setting you are asking questions of. So we can do inspections or assessments virtually when possible, and that's something that, you know, whatever works for you. If you like Teams or Zoom, or, I mean, worst case scenario, we could Facebook, FaceTime, whatever works for the individual person that needs the assessment. We generally would like to work through the housing department, so we can do things virtually if you prefer that we don't come in person, or that we just can't due to requirements at the community level or the provincial level. We're also working continuously on the water and wastewater project team. So I know that is something that's very important to communities, long-term drinking water projects. So that continues to happen. We continue to work with those teams. We have been providing more virtual training sessions. And again, I'm sure there's been a few hiccups with all of these new methods that we communicate with each other, just like this presentation today. So, you know, with that in mind, trying to be patient and trying to ensure that we have enough time allotted when we work with communities. So that's really what we're trying to do right now, is adapt anything to meet your needs. So for example, I think we have a community-based water monitor course on Zoom tomorrow, and in a couple weeks, we're doing a food safety training online. So we'll do what we can to ensure we still meet those needs. Insect identification, a simple example, you know, before we'd like to get it in person. Well, now we'll take any picture and video you can get, and we will have someone review that and make sure we can get the info back to you quicker. Mailing things out is not fast anymore. It's not useful a lot of the time, just because there's so many things coming up and down from the communities. So we'll do what we can to get you information quicker. So there's a lot of new resources out there. And again, if you're like me, you have a lot of unread emails in your inbox, and it's just, that's the nature of what we're all kind of faced with right now. So if we can assist you with any of these guidelines, give us a call. So essentially, these are ones I wanted to share, and these are specific to ventilation in homes, so residential homes. The Public Health Agency of Canada has developed this guideline. They look at how ventilation combined with other measures will reduce COVID in your home. There's some practical tips for how to improve, you know, ventilation and filtration. And it's intended generally for indoor environments. And again, this will be different if you're dealing with a daycare or a school or an office setting. These are very, you know, general recommendations, but there may be something extra out there we could find for you for a specific setting. And I'm just waiting for my slide. There we go. So I'm just checking my time. There we go. So new resources for indoor air ventilation, the key messages. And I think, again, I know that these messages we've heard again and again, but very important. The virus is spread through droplets and aerosols. So what does that mean? That means if you're in a small place with people or an indoor situation where you have close proximity to another person, your risk is increasing. What are the most important things that we can do? I think we all know what these are. Using our masks, using them properly, sanitizing before and after you take it off. Talking with family members and people about the safety of using masks. You want to minimize the number of people in any places at the same time. Right now we have a stay-at-home order, and that's the recommendation of the province, is that we just don't go anywhere if we don't have to, unless it's essential. Try to maintain that distancing, using these masks we've talked about, well-constructed, well-fitting masks, and of course, hand hygiene and respiratory hygiene. And I'm sure if everybody held their hands up, we would see we would see over time, our skin has suffered a bit from using a lot of products. So take care of your hands and moisturize so that you don't end up with cracks and things that could cause infection. It's been a tough year on our hands, I think, but very important. So what are the biggest things, again, that they recommend? Adequate ventilation and preventative measures. Good indoor ventilation alone can't protect you from the virus. So if you're in a house and you think, if I increase my ventilation to this in the home, it doesn't matter how many of us are in here or how close we are, it's going to suck all the virus out and we're going to be safe. And unfortunately, that's not the case. It's really the close contact with the individual which causes the spread. So we know that there's certain settings that are riskier. So you crowded places, enclosed spaces, or close range conversations. I think they say it's about 15 minutes. When you're close to somebody within 15 minutes, that really is kind of a risk factor that they look at. And then again, risk is higher when other factors overlap. So if you're like a singer, or you're a shouter, or you're a spit talker, if you're running and you're a heavy breather, well, these are all situations where that virus can travel a little further out of our mouth and cause a greater risk. So we all understand, gatherings, we understand that we should try to keep people from outside our household. Unfortunately, try and keep that distance for a little while longer. And it's important, especially when you have somebody in the home that's especially vulnerable to the virus, an elder or somebody that has underlying issues. But I really want to reiterate, we don't know always if we have underlying issues. So even though people look healthy and they're not an elder, or they're not a very young child, they still may have underlying issues that put them at risk and may not be aware of it. So even though you look healthy and you feel healthy, it's you're putting yourself at risk if you assume that there's no chance that you don't have an underlying condition. There's also higher risk activities, which again, if you're singing or you're in a big crowded space. One thing is, avoiding smoking indoors. And I think the big one is that there's an increased risk with respiratory infections when you're a smoker, plus the fact that you're bringing your hands to your mouth more often, which means perhaps there's a chance for the virus to spread. We all know crowding is something that can be a real issue, and a lot of the communities are facing is overcrowding in homes. We have, multiple people in a home, or multi-generational people in a home that has poor ventilation. So in these situations, yes, it is important to try and improve the ventilation as much as possible. And what they say is that it can't alone protect you from the virus, especially when you're within 1 to 2 meters of each other, but it certainly can increase the fresh air in the home, removing pollutants. And that's important for every day, is to ensure that you have healthy air in your home that you're breathing. So other things, and I'm not going to read everything we've talked. I know this again is something that we hear all the time. How do we prevent ourselves from getting sick? Keeping visitors, away for a little bit longer during this time. Someone from your support bubble, you want to make sure that they're not in another bubble. So, if you have an elder that is part of your bubble, that's really important. So you have anybody kind of alone in your community that you can bring into your bubble and keep them safe, and so that they have support from other people is fantastic. And that's something they recommend if somebody's alone. So, care workers, they talk about you can open more windows if you have somebody coming, or if there's, if someone has to come in and provide some medical care in the home. There are simple things that you can do to reduce the risk a bit, running the fans, and opening more windows, avoiding, the ceiling fans blowing down on you while that person's in your home. And again, these are kind of worst case scenarios. Somebody's got to come over, and we're going to try to prevent being close to each other, and we're going to try to do what we can so that we're not spreading it that way. And again, if possible, just don't be close to the person in the home. You would be in another room and they would do their work. So again, box fan in a window is a really simple way of just blowing air either into the room or outside, a cheap, effective way of increasing ventilation. Spring's coming, so I know that wouldn't have been a useful recommendation a couple of months ago, but it's something that you can do now to increase the ventilation. So indoor ventilation in homes, essentially, this is always something that's recommended, is that your heating and ventilation and air conditioning systems, excuse me, are functioning, are maintained and operated according to the instructions. You ensure that you utilize your HRV. And I know, again, there was a really good presentation on HRVs, and there's a lot of good information out there. Ensuring that you clean your filters often. If you've had, situations where people have been positive for COVID, you could wear a mask and gloves when you're changing your furnaces in the filter, or if you're part of the housing maintenance people in the community, these are things, you would want to make sure you have PPE on when you're attending a home in the community to protect yourself and the people that live in the home. And then, of course, if you can increase your ventilation on your home, they say to do that. If you don't have a heat recovery ventilator, then you could just turn on another fan, like a bathroom fan or a kitchen fan that directly goes outside, and that would help improve air ventilation in the home as well. I know we're going close to time here, but I really just want to touch on a couple of things. Portable air cleaners and air purifiers. Right now, there is no evidence to support that these air purifiers or air cleaners are effective at reducing the spread of COVID-19. So on this whole slide, that's the most important thing to understand. There's no evidence to support that these reduce the spread of COVID-19. So if you're going to use devices, there are recommendations here. And again, these resources, this is my resource here. It's the ventilation in homes during COVID. We will have this accessible online tomorrow, or you can email any of us or contact us and we'll share that with you. But I'm going to show you how to check if something is an approved device. So this is a website that you can go to, and this is for medical devices related to COVID-19. So if somebody comes to your community and has something they want to sell you, and they tell you that it kills COVID, it removes COVID, it's approved for this, we can search this and have a look and see if that is a valid claim. And if you're not comfortable doing this, you can call us and we will help you, and we'll try to find out as much as we can, because we know during these times a lot of things are brought into communities, and people are trying to sell their wares and their equipment. And of course, a lot of things are wonderful and valid, but if it sounds really too good to be true, let's make sure that it's an approved device and that there is information to back up any of the claims that these individuals have. The other piece I wanted to talk about, and we've seen recalls with masks already, we've seen recalls with hand sanitizers, and we've seen recalls with disinfectants. So if you are not sure, you want to double check the disinfectants that your community is ordering or that you have in stock. We can search these on this website here. So you can see it has lists of disinfectants, list of hand sanitizers, information on manufacturers. So really easily you can do a search and make sure that that sanitizer or product, disinfectant that you have actually kills COVID and is effective. So that's something I think is a really handy little tool. And of course, follow the instructions and all the guidelines on your disinfectants. You want to make sure that you're using them according to manufacturer's instructions, because you want to make sure that you are not putting yourself at risk using a chemical incorrectly, or on a food service or something like that. So those are really two really important things you could take away, is when things sound too good to be true, especially with killing COVID or getting rid of COVID, let's do a bit of research and make sure before you invest in something like that, that we have the right and most current information. Humidity is another one, again, with mold growth, with good air quality. You always want to maintain your relative humidity about 40 to 60. They actually say when your humidity is low, it can cause those air droplets that hold COVID makes them shrink and they can stay in the air a lot longer, which is really interesting. The science behind all of it's very interesting. So the main message, just like mold and improved air quality, is keep your humidity between about 40 to 60%. This is the document that I've talked about today. I wanted you to know that the final was just made available in March. So I will have that available on our trade show booth tomorrow, and any HO you contact should have this available to share. We have shared it out already, but if you missed it, let us know for sure. So that's everything for today. I just wanted to say thank you to the committee for having me speak, and thank you to Darlene. I'm going to stop sharing. There we go.
Okay, so I don't know if we have any questions. So I don't know if anybody wants to ask any questions. Nicole, do we have anything? Okay. Where can I get more detailed information about improving ventilation and housing during COVID? That's first question. You gotta unmute yourself.
I always do that. My staff are going to giggle at me for that one because so that's a great question. So we talked a bit about today about how to improve ventilation in all settings, including housing. There are multiple sources where you can get information. I think everyone's familiar with the Canadian and housing. So CMHC Corporation, they will have information on general ventilation, things like mold, indoor air quality. It'll talk about HRVs. It will have information on if you burn wood, how to maintain your HVAC system. So it has a lot of information there. And then if you're looking for more specific information about COVID, you would I would recommend the Public Health Agency of Canada website, or the provincial Ontario website will have multiple COVID guidelines. Again, this can be a bit overwhelming because once you start looking, you're going to find a bunch of guidelines. So if you want your EHO to kind of pin it down and say, out of the provincial or the federal, this is the most protective, this is what we recommend that you put in place in your community or this setting. So we can help you that way. So you can reach out to the environmental health officers, or again, you can pop in and visit us tomorrow during the trade show.
Okay, you probably answered the second question. It says, are there any new COVID ventilation guidelines for public buildings like long-term center facilities?
So actually, that is a great question and really timely. And I actually just received an update yesterday on the 12th. Sorry, the 12th, I received a new information about ventilation and filtration to reduce aerosol transmission in long-term care homes. So I know there are a few communities in Ontario, and I would assume other communities outside of Ontario that have some long-term care homes. So if you're interested in that, again, we will have that available, the link available on our trade show booth tomorrow, our trade show session there. People can pop in and we can share that.
Okay. I guess those were the only two questions right now. And you'll be at the trade show tomorrow, so there'll probably be more questions over there. So I want to present you and thank you for your presentations and your information that's out there for First Nations and whoever else when it comes to the health and safety. Thank you for your presentation. And we like to have I guess a painting presented by Daryl Big George. Do we have as part of the gift for your presentation?
That's beautiful.
Is there a picture? Oh yeah, right there.
Beautiful. Thank you, Miigwech.
Miigwech for your presentation.
Thanks, Darlene.
And And we're going to put up our passport code. So the passport code is up. And please write down the session 2 code, which is healthy, for your passport to prizes. And if you could possibly fill out the session survey at the bottom of the page, which will be sent out to you guys, I take it. So for tomorrow's sessions is the Builders Challenge and Trade Show. So it's going to be starting at 1 p.m. Eastern, so it'll be 12 my time Central. So there's a lot of opportunities to win some prizes at that time. Okay. So anyways, I guess the session 3 code is plan. So there we go, PLAN. So that's the code. Passport to prizes. So delete the other one I said. So it's plan. So there'll be prizes like Visa gift cards, a Fitbit, and power tools. So we'll see you then.